Let's talk about the prevention of prostate cancer, because that's a really, really interesting topic. You know, there's something about men's health and prostate cancer. What can we do as guys? You know, if you talk to Mark Moyet, and I know that Joel knows Mark pretty well, he is one of our nation's leading experts in nutritional supplements from the University of Michigan. He's also one of the board members on our foundation. He says heart healthy is prostate healthy. And people always want to know what they can do to reduce their risks of getting prostate cancer and stopping that disease from marching on if they should, unfortunately, get prostate cancer. So I'm going to ask Dr. Powell first, what is the metabolic syndrome? And does the metabolic syndrome have any linkage whatsoever to prostate cancer? And if it does, what can you do to change its course?
Well, yeah, I'm glad you asked that question because it's becoming more and more important because we have a society that's overweight. Obesity plays a major role. It's one of the major features of metabolic syndrome, as well as hypertension, as well as diabetes and high fat or triglycerides. Those are the primary components of the metabolic syndrome that impacts on prostate cancer. And what we have learned about the obesity is that fat has to have blood and oxygen to grow. And when that happens, there are certain genes that are responsible for increasing the blood flow. Those same genes increase blood flow of cancer as well. And also they need oxygen. And the oxidative stress syndrome is responsible for a worsening of prostate cancer. And so the obesity produces more oxygen, is good, and more blood is good for the fat, but it's not good for cancer. And what specifically in obesity is the cells called adipocytes that produce these genes that cause the blood flow to increase as well as the oxidative stress. And those genes are associated with inflammation, specifically pro-inflammatory cytokines.
I really appreciate it. That was so scientific. I'm almost blown away. But, I know that the one thing I always hear is that visceral fat, that fat that sits within the belly, is the most toxic fat in the human body.
Right.
And that it leads to all these like free radicals. And I guess anything that has the word radical has got to be bad, I guess. Yeah. So it's got all these free radicals that can cause bad things to happen inside your body.
Right.